Good evening, everyone. Welcome to this informative live session where we'll explore a crucial topic, genetic testing for gynecologic cancers. I'm your host, Maitri, and joining me today is Dr. Pakhee Aggarwal, a specialist in gynecologic, oncology and robotic surgery. Welcome, Dr. Aggarwal.
Thank you, Maitri. I'm delighted to be here to discuss the role of genetic testing in hereditary gynecological cancers and explore some of the risk-reducing strategies which can greatly benefit patients. This is indeed a very important topic in women's health.
To start, Dr. Aggarwal, could you explain what genetic testing for gynecologic cancers involves and why it's significant?
Right, so as we know, our DNA or genetic makeup is made up of small elements which are called genes. With a lot of advances in molecular medicine and testing, we have now been able to map the entire human genome. And with that, we have been able to get the key information regarding certain genes which, when they become faulty, are related to an increased risk of cancer. So when we talk about genetic testing for cancer, we are looking for these faulty genes in the genetic makeup, which usually are handed down from generation to generation. That is, they are hereditary and thus predisposed to similar types of cancers in the same family. So genetic testing generally involves consultation with a genetic counselor first, followed by either a blood or a saliva test to look for the DNA and to test for these faulty genes. After that, you have another counseling session with the genetic counselor who explains to you the implications and the results of the testing. It is important to note that genes are present in the human body and DNA damage and repair is going on at a cellular level in all cells. Genes which predispose to cancer work in one of the two ways. Either they disrupt the repair mechanisms which are normally going on in the body, as a result of which the repair becomes faulty, and when these DNA damages add up, they predispose to cancer. Or they let the cells proliferate uncontrolledly. So there are certain genes which we call as tumor suppressor genes which are normally present in our body. And when there is a mutation in these genes, they are not able to suppress the normal cells from overgrowing. And when the normal cells overgrow, they tend to mutate and turn into cancer. So when we are talking about genetic testing, we are basically looking for mutations in these tumor suppressor genes. And the common tumor suppressor genes are P53, which you may have heard of, BRCA, and certain other genes which are linked to ovarian cancer and colorectal cancer.
Thank you, Dr. Aggarwal, for that insightful explanation. Now, let's discuss some practical risk reduction strategies that individuals with a hereditary risk of gynecologic cancers can consider.
So when we talk about gynecological cancers, we are talking about ovarian cancer, about endometrial cancer, and about breast cancer. For these, if someone has faulty genes in their genetic makeup, and they have been tested by means of the appropriate genetic test, then there are certain risk-reducing strategies which we can offer. For example, to reduce the risk of ovarian cancer, there is a surgery which is known as a risk-reducing salpingo-oophorectomy, in which the tubes and the ovaries are removed at the age of around 40 or after the completion of childbearing, because these cancers, they generally occur in the age group of 50 and above. So once we are removing these, then the risk of these cancers goes down. Similarly, there is something called a risk-reducing hysterectomy, which is done in women who have an increased risk of uterine cancer. And risk-reducing prophylactic mastectomy, which is removal of the breast and reconstruction of the breast, is also done in those women who have an increased risk of breast cancer. So these are some of the risk-reducing strategies which are surgical. Other than that, the other risk-reducing strategies are that these patients are kept on regular follow-up. They have periodic screenings which are more frequent than the general population, and these screenings can be in the form of ultrasounds or mammograms or blood tests, and periodic visits with a gynecologist to look for any changes which may be turning into cancer. And at that point, again, surgery is one of the options which is offered. Sometimes we do offer certain medicines in the form of injections or pills also, but these vary from individual to individual and can best be decided in consultation with your doctor.
Thank you, Dr. Aggarwal, for those practical risk reduction tips. Dr. Aggarwal, receiving genetic testing results can have emotional and psychological implications. How can individuals cope with this information?
No doubt, when you have a family history of cancer and you are offered genetic testing, while you are waiting for the results, there can be a lot of psychological distress and anxiety which happens. If the test result comes back as positive, it does not mean that you will definitely develop cancer, but it shows that you have a higher predisposition than the general population to develop cancer. So while waiting for this to happen, there can be nervousness, there can be anxiety, there can be loss of sleep. So these are some of the common psychological problems we see. And even if the testing is negative, we have seen patients, they feel guilty and they feel anxious as if they have done something wrong to be spared from this genetic problem. So in either scenario, you do need a lot of psychological support and counseling, which is why it is always good to be in touch with a genetic counselor, because even before you undergo the testing, you must understand what are the implications of the test, what is the benefit of the test to you, because these tests are also expensive. So we do not offer them to everyone. We only offer them to those patients who are at high risk. For example, those who in whom the family history is very, very strong. Multiple relatives are having the same kind of cancer. Cancer is occurring at young ages, or they have already, the testing for the tumor has been done and it is showing a genetic problem. So all of these things are discussed with the counselor beforehand, before you even go into the testing. And once the results come, also a lot of psychological support is needed. And we do have psycho-oncology services as well, which work specifically to counsel patients about these problems.
Thank you, Dr. Aggarwal, for addressing the emotional impact and offering guidance on how to cope. Dr. Aggarwal, how accessible is genetic testing, and are there any barriers individuals may encounter when seeking these tests?
Genetic testing has become more accessible over time. There are many labs now which offer the complete spectrum, from testing for specific gene mutations to analyzing the whole genome of an individual. But like I said, these testings are expensive and they are not for everyone. We only reserve them for the 5 or 10% of the population, because only 5 to 10% of the cancers are actually hereditary in nature. 90 to 95% of the cancers are linked to your own lifestyle or other risk factors. So it is only 5 or 10% of the population which fits into the spectrum for genetic testing when they have a very strong family history. These tests are available through many labs, and you need them to be prescribed by a doctor before you go ahead and get the testing done.
Thank you, Dr. Aggarwal, for sharing your expertise on genetic testing for gynecologic cancers. It's been an enlightening discussion, and I hope our viewers have gained valuable insights into this crucial aspect of women's health. Any last message for our viewers?
Thank you, Maitri. I appreciate the opportunity to raise awareness regarding genetic testing in gynecological cancers, because knowledge is a very powerful tool in our armamentarium. If we are aware, then we can go ahead and get tested and reap the benefits of the same. Thank you.
Thank you to our viewers for joining us today. Your health matters, and understanding your genetic risk is a step toward better healthcare. We'll be back with more informative sessions in the future. Until then, stay informed and stay healthy. Goodbye.